With part C of chapter 8, we will finish up with the ankle and the foot. So notice that the tarsal bones are arranged a little bit differently than your carpal bones. One reason for that is that your wrist or carpal bones are there to allow the hand itself to move around. The tarsal bones are there for support. So all of the weight that's delivered onto the pelvic girdle, then into the femur, then from the femur onto the tibia, and then the tibia, of course, onto the talus or major tarsal bone. So it's there for support. The talus does form the joint for your ankle. So with the tibia and fibula and the talus come together, that is your ankle joint. The calcaneus, of course, forms the heel, and you have the Achilles tendon attached to it. So the proximal row, you have the calcaneus, you have the talus, and you also have the navicular bone. Then the distal row, you start to have the cuboid, you have the lateral, intermediate, and medial cuneiforms. So with the cuboid, you have three other cuneiforms. You have the lateral, of course, toward the lateral side, intermediate in the middle, and then medial toward the midline. So a lot of people will use a mnemonic. Can't talk now because Lucy is mad. Okay, so of course that would be the calcaneus, talus, and navicular. Then the cuboid, lateral, intermediate, and medial cuneiform. With the foot itself, these are your metatarsals, and again, metatarsal 1 begins with the large toe, the great toe. Remember, just like the thumb, as far as phalanges, it only has a proximal and a distal phalanx to it. Then your pinky, of course, is number 5, and then with the phalanges that are associated there, the other 4 phalanges, you have both the proximal, middle, and distal phalanxes. As far as foot arches, a lot of people do have the condition where they are flat-footed, so the sole of the foot is abnormal if it lies flat on the ground. So these arches are shown in the textbook and the lab book, where you have the medial longitudinal arch. So that is the one that goes from the heel to the hallux, so that's the one in purple. You have the lateral longitudinal arch that goes from the heel to the little toe, so that's the blue. And then you have the transverse arch that goes directly across the middle of the foot. They're actually at the big arch of the foot, and that, of course, is the red arrow. And, of course, if someone is flat-footed, they say that the condition is pes planus.